Hello, everyone, and welcome. This is Dr. Shahin Sadik. Before I get started, I want to thank Roxanne and all the wonderful volunteers that have made this event possible. I'm very happy to be part of this year's CRPS forum again, and I'm happy to spend some time with you in this pre-recorded presentation talking about living strong with CRPS. Can you have a happy life with CRPS? What do you have to do to have a good life? With CRPS, your pain is invisible and nobody can see it. It's not like a broken leg that everyone sees, or you can even tell what's wrong. You suffer internally. You do not have some swelling or atrophy. You don't understand what's going on. And by that matter, nobody else can understand what's going on. Living with CRPS is very difficult, but you can win, definitely. There is a lot to look for in living with CRPS. Let's give you an example. Okay, so you have a 17-year-old who had a minor foot fracture. It started healing, but then it stopped. It started having increasing pain. The x-rays showed it healed, but the pain got worse. Then the 17-year-old tells the family. The family talks to the doctor. Sometimes the doctors don't believe it. What happened here? Why did this happen? You, I think, are feeling where I'm going from here on. In general, many CRPS cases may resolve, but a lot of times they continue. This is a case where CRPS is setting in. CRPS can be a short wave or can transition into a very long, arduous, chronic pain syndrome. Initially, the leg or the arm or body part may be warm and red, then it can turn into cold and blue, and it feels awful. The main thing about CRPS is that there is a constant pain there that is bothering you day and night. This disease is real, but the mechanism is very complex. There are peripheral nerve and central nerve systems that are involved. You have an urge to avoid moving the body part. But after a while, if you don't move the body part, you get worse. So you get into this catch-22, and it makes it very difficult for you to know what to do right. CRPS can occur in patients who have had an injury, a fracture, a surgery. Sometimes CRPS can happen in cases that you don't know what happened. CRPS is a very personal experience. It's very difficult for somebody else to actually feel what you feel, even a doctor. It was first recognized as a distinct pain condition during American Civil War, where a lot of the soldiers were coming home with amputated legs and continuing to have severe pain. A 30-year-old starts having a burning pain in the wrist after a small fracture. Then the 30-year-old starts having burning pain, pins and needles, squeezing pain in the limb. What happened here? CRPS, in a lot of cases, in a situation where it is difficult to diagnose by tests. It is a clinical exam. It is based on how the patient feels and what the limb looks like. So it's very difficult a lot of times to have a certain test that tells you exactly what's happening, but there are certain strong criteria that show you that the patient is having CRPS. CRPS can spread outside the originally affected limb. There is no known cure, but there is a lot of things that can be done in face of CRPS. There's no question that CRPS can be won. CRPS is a neuroinflammatory disease. That means your nervous system is involved and your immune system is involved, and it affects your muscles, your joints, and it can be widespread. It can start from one part of the body, then spread to the other parts. It can be nasty. We don't know how it starts, but as I mentioned before, sometimes a previous injury or surgery can cause it. Okay, in CRPS, the entire nervous system signal system changes. Your entire body can become hypersensitive, and there is a lot of abnormal function, abnormal movement. There is some parts of the body may experience atrophy. Some you might develop tremors. You lose enjoyment in life. You forget about tomorrow. There is a lot of pain and frustration to deal with right now. The most common symptoms are non-stop pain and burning pain and sensitive areas. Depression is very common, and treatment is not one size fits all. Almost all treatments require your direct participation. But can you handle it? Is this the end of the world? Hang on, there is more. Let's describe more symptoms. CRPS can rob your stamina. It makes your body hypersensitive, even in the areas of the body that didn't seem to be directly involved. Stress worsens pain, and CRPS causes more stress. It can also have negative effect on your social and financial health. A 24-year-old starts having daily swelling in the leg after daily jogs. What happened? The pain continues, burning continues. They do immobilization, they do a lot of ways to reduce the pain, but the pain continues. In CRPS, the muscles, the fascia, the joints, the brain, everything is involved. It's very difficult to isolate CRPS. However, there is a lot of things that you can do. One treatment does not fit all. It's different for everybody, but we can definitely deal with situations such as cardiovascular deconditioning, which is very common because people don't want to move. If you have a lot of pain, every time you move, you don't want to move, so you become deconditioned. It's all this. Is it inevitable? 33-year-old CRPS patient develops a burning pain in a different part of the body. Is this CRPS? You don't know. Don't panic. It's common. You know, everybody develops pain in different parts of their body, whether you have CRPS or not. It's good to keep an eye on it, and it's good to talk about it with your doctor. Going back to CRPS, it's very hard to be happy when you can't walk without tremendous amount of pain. You see people your own age that are, for them, walking, driving, picking things up, shopping for groceries is effortless. For you, it's a big task. Every time you do something, you hurt yourself. CRPS affects sleep. And CRPS experience is a combination of orthopedics consequences associated with all the other things that cause the pain to get much worse, and neurological symptoms. Getting out of bed is a chore. Daily activities are difficult. Pain itself causes severe lack of concentration. Can you deal with it? Okay, let's go to the plans. Game plan. What methods can we use? When we continue to guard against movement after the initial healing process is complete, we are doing more harm than good. And the protective response becomes maladaptive. In other words, after a while, you need to get moving, but you have to have a plan to get moving. You don't want to hurt yourself too much by moving. A little pain is okay, not too much pain when you are moving around. How do you do it? Okay, so you want to improve the pain. You want to have support groups, people who know your situation. You want to have relaxation techniques to learn. CRPS treatment is patient-centered. In other words, it's the patient that you treat and not the disease. Really important. So you want to increase mobilization, increase range of motion, reduce anxiety, and help alleviate things that are happening in your life. It's difficult. CRPS wreaks havoc, but you can do a lot with it. Get involved early. We as patients need to be involved with treatment and from the beginning. It's a tough concept, but it's a very rewarding concept. I promise you. With CRPS, there is a lot to accomplish. Think of it as that way. You are rebuilding your life. Ultimately, everything up to this point is based on what you want. What are your functional goals? What are the most important activities that you want to have? For an older person, being able to take care of themselves, ability to live independently is very important. For a younger person, maybe being able to dance with their partners, go out, take care of children, take care of a job, any job, have some sort of financial independence, write it down and go for the goal. Sometimes smaller things like sitting, standing tolerance, walking, ability to transfer from standing to sitting, and lifting, carrying, pushing, pulling, all of these gross motor skills need to be retaught gradually. Write them down, please. Write down what goals you have. Education, education, education. At the same time, we got to look for reducing the pain. All this should be incorporated where appropriate to meeting your functional goal. You want to engage in activities that you enjoy to unlock your body's natural pain relieving ability and make another step to reducing the CRPS and having a better life. Okay, normally human beings walk down the street and to the store just fine, and you can barely walk to the store. You can barely walk in the store. It's easy to give up and not do anything. It's true. You have to learn to do it. You have to learn to make a new life, and it can be hard. Keep planning, keep dreaming, keep getting a little out of your comfort zone, just a little bit more. Get psychological support. Pace your day. Don't be shy to do a little at a time, and don't be shy to increase that little at a time. More activity, and keep dreaming about your future. We have long-term goals and short-term goals. Keep your eye on both. Short-term goals, how am I gonna get through the next couple of weeks? Long-term goals, what do I want to be? What do I want to do the next few months? It's difficult to learn this way, and believe me, a lot of what I'm telling you is common sense, but I promise you, if you think in an organized fashion and you say to yourself, okay, so you know what, for the next couple of weeks I'm gonna try to be a little bit more mobile. I'm gonna try to do something pleasurable that doesn't hurt me too much and see what it is. What is it that makes me feel better? Sometimes also you have to take a break from news and social media and just enjoy the little things in life. You have a lot of inner power. You should unleash it slowly. Make plans for every day. And you know what? If you make plans and you want to change them, do it. Change your plans, but make plans. Pain management planning is critical. You want to know how to treat the daily pain. You have a plan for that, okay? It's not always doable. You can't always treat the pain the way you want it. You'll have good days and bad days, but you can avoid nasty flare-ups. See what caused the nasty flare-ups. Sometimes you don't know. Sometimes you just have to deal with the nasty flare-ups and say, darn it, this one really got out of hand, and then go to the next situation. So every day the pain experience is different, and every day you need to be cognizant. You need to be looking inside and looking into the pain and your inabilities every day and be a warrior. So how do you do that? Seek help. Friends, family, doctors, nurses, organizations, CRPS forum, you name it. Write a diary, please do. You don't need to be a fancy diary writer. Just say a few things. What was I doing today? How did it go? How did the pain situation go? What did I do to forget the pain? What did I do to make the pain worse? Challenge yourself daily. Make plans. Don't be afraid to take medications. Educate your friend and family. Write a diary that's unique to you. CRPS is nothing to sneeze at, and the more seriously you take it, the better. You cannot let the disease run your life. There is a fine balance, but you'll do it. Seek professional and personal help. Early treatment is the best thing. Give your friends and family lots of reading material to actually go over. Keep them interested, especially if they are interested and they want to help you. Chronic pain and inability to move around can cause depression, anxiety, loss of self esteem, and feeling bad about yourself. This becomes a part of a vicious cycle that feeds into and amplifies the negative effects of pain. The neuropathy gets worse. Be in touch with your inner abilities, nurture them, accept the fact that your ability to function is different than before. It's not your fault. You're not a sissy. It's just that your physiological, neurological, orthopedic, musculoskeletal situation is different. Seek help, both physically and emotionally. Hypnotherapy is good. It's more effective, by the way, to pursue professional help. There is a lot of tales about treatments, etc. I don't know what to think of them. Cures. You can look into the internet about cures, about everything. Take it with a grain of salt. Ask around. There is plenty of CRPS community groups. I love CRPS forum. Doctors, your family doctor, your friend with an experience, your friend who wants to help. When you visit a doctor or a clinic, take a look to see how much experience they have. Make sure that they answer your questions in details. You don't have to overwhelm them, but write them down, give it to them. And sometimes the doctor answers them, sometimes the nurse answers them, sometimes they give you a brochure. Take them all. And by the way, you may have to visit several clinics before you're comfortable with one. That's okay too. That's part of the game. Keep it up and keep going. Go with the different doctors that you love, and you will do very well in the end. Write down what you want to talk about. Write down what you're gonna say. This is all very important. It is very critical that you actually should be able to continue to talk about the pain with your doctor and uh, with your loved ones, and it's very good to have a rapport with your loved ones. Your pain specialist will probably go through a lot of medical information. Bring your medical information over. Have a copy of all your medications, dosages, frequency, any implantable devices you've had already, any tests you've had already, and maybe a letter from your family doctor. Bring somebody with you to write a journal about it for you. It's very helpful. And also, when they want to examine you, tell the staff what areas to avoid or be careful, or at least tell you before they touch it. Where you can be touched and what positions you can tolerate are quite critical. Ask why. Why this treatment? Why that treatment? Don't be shy. Believe me, Everybody enjoys a friendly face, especially in chronic pain where it is very hard to have a friendly outlook, friendly face, friendly demeanor. The problem is that you're an active participant. So if you're a sourpuss to the people who are trying to help you or the professionals, then it becomes difficult for them to treat you. Be genuine but friendly. Be open to procedures but ask lots of questions. Some procedures help for you, not the other person, and vice versa. Injections can reduce your symptoms. Medications have a lot of side effects, but try them out. If they have side effects that are not tolerable, you can stop them and discuss them with your doctor, but work with your doctor. I'll talk to you about spinal cord stimulators in the next slide. CRPS is not a death sentence. It's not even a horrible diagnosis. Our Maker made our bodies with a lot of resilience. Medications you try all have side effects. Try them. There is no specific treatment medication that is only for CRPS. A lot of the medications that are prescribed are not even FDA approved for CRPS. Try them. A word about spinal cord stimulators. The latest studies show that early use of spinal cord stimulator is very helpful in general for CRPS. Not for everybody, but for a good number of patients. There's high level evidence supporting this. It helps with the perception of the pain and quality of life. The good news is that the technology is evolving. It's getting better and better. I have had patients who tried spinal cord stimulators 10 years ago, never mind 5 years ago. And now I ask them to try, and a lot of them succeed with it. Technology is changing for the better. A thing about DRG stimulation, it's a new approach for certain patients. DRG stimulation also is wonderful. There are many. Discuss them with your doctor, and I think you will be rewarded. A word about friends and family. They can be very valuable assets to you, but they can at the same time express attitudes that are hurtful to you. They don't know any better, okay? They're not in your body. Only you can understand. Educate them. If they're close to you, they're suffering with you. Educate them. If you think that a friend or a family member is just unable to understand your situation, just respectfully don't share your CRPS experience with them. But you look so well. You don't look ill. Oh, you've had this problem for a while. How come doctors are not doing anything? You're just being lazy. I can't believe you are in so much pain. Why aren't you better yet? Sounds familiar? Educate them. And if you can't, just avoid the subject. Often you and your friends initially can get overexcited about a new treatment. Remember though, CRPS is a difficult condition to treat. So yes, I want you to be excited about different treatment methods, but remember that have a healthy dose of skepticism, have a lot of enthusiasm, but also have a lot of skepticism. I want you to look for ways to improve the situation, but at the same time, continue to do all the other things. There is no one thing, there is no one panacea in CRPS. More about family and friends to fight CRPS. Have them come to the appointments with you. I've said that in the last slide. So sometimes it's really helpful to get them to have an open communication with your doctors and nurses, with your permission, of course. It's very difficult to deal with CRPS alone. I'm sorry. At the same time, remember, family and friends are suffering with you. They want to help, they're unsure how to help. It's difficult for them to see a loved one having a difficult situation. At the same time, they want to know what to do, how to help. Use them. Get them involved with your medical care. Get them involved with whatever that you need. You will reward them later with other things. The reward of helping you may be just enough. Remember, everybody can help in a different way. Excuse me. Okay. So let's switch gears now and talk about how to reduce physical decline caused by CRPS. Now, physical therapy to a lot of people is the same thing everywhere. It's not. There are so many types of physical therapy, and there are so many types of physical therapists and methods. What's important is the types of activity, physical activities that you get involved with that are tailored for CRPS. In general, what they do is help you increase your movement and strength slowly without making the pain too much worse. It's okay to be sore after exercises. It's not okay to be miserable after exercises. You and they need to find the balance. The other thing that helps reduce physical decline, and physical therapists can help, is desensitize the area of the CRPS. Really important. You need to have an exercise program to keep the pain and body parts moving. That will improve blood flow and lessen the problem with the circulation system. Exercise increases your body's flexibility, strength, and function. That arm, leg, whatever area of the pain you have, once it starts moving, it sends positive signals to the spinal cord and brain, and that reduces sensitization. It reduces depression, believe me or not. Depression and pain are together. Once you reduce one, a lot of times you reduce the other. We talked a little bit about desensitization. It's a technique used to reduce sensitivity of the affected part. It could be physical, it could be mental relaxation techniques, it could be desensitization, it could also be done by medications. Desensitization and physical reactivation can be very uncomfortable and painful at first. Give it a chance. Everything when done first time is difficult. The first time you walked, the first time you used the bike, very difficult. It'll get back. Your body will get used to it. You will feel better. But if you don't try it, you'll never get there. Try it. It's good for you. You want to be in the best shape you can. How do you do that? a sensible exercise. Do it day in and day out. Ask for home exercises. Ask for homeworks from your physical therapist, from your doctor, and from what you got so far in your own mind. You want to increase function. The other thing that's really important, maintain a daily schedule. Don't have a day that's just you're in bed all the time or you're not doing anything. There may be days that you just have to do that. But keep those days very, very rare as you can. Have a schedule. Get up, eat breakfast, do things. Do what was a little uncomfortable. Do what is pleasurable. Make use of the affected area as much as possible. If it's your hand, touch things with it. Do things with your hand. If it's your leg, stand up a little, walk a little bit, do some range of motion exercise. That's good for you. So, just to wrap up a little bit on disuse, which is a bad thing, you want to reuse that body part. You want to manage the hypersensitivity, and sometimes there is swelling. You want to help with that. Any exercise you do should be slow, stepwise, within your comfort level, but not in a situation where it doesn't cause any pain. Yes, it will cause a little pain. Range of motion is very important. Gentle strengthening is important. Stress loading, meaning if it's your leg, you want to put some weight on it. If it's your hand, you want to pick up something with it. It could be something small, but it's anything you use to put pressure on the bones, put pressure on a little bit of weight, small weight on the joint. It's good for you, good for the nerves. So in general, to wrap it up, therapy for RST CRPS should address pain, hypersensitivity, and range of motion. Active range of motion is important. Slowly do it with a therapist. It helps you with increased function. It'll also reduce your pain. If there is no physical therapist in your community that treats pain patients with CRPS, ask around. At least see the therapist that sees the most people with chronic pain. Many of the same chronic pain management skills can be used for CRPS. You can also encourage your physical therapist to help you by educating themselves to help. Changing gears a little bit, medications. Please remember, medications are generally prescribed according to following characteristics. A lot of them are off-label, as I told you. Treatment for inflammation is still useful. Non-steroidals, Advil, aspirin, naproxen, indocin, they can have a value, especially for inflammatory portion of your pain. For the constant daily pain, there is a huge number of medications, including antidepressants and anti-seizure medications. For the jolting pain and nerve pain, there are anti-seizure medications, there are analgesics, etc. For sleep, there are medications. More severe cases not tolerating therapeutic exercises need to be dealt with carefully. A lot of times you absolutely need a medication to help you to deal with the situation. Medications for CRPS are not without side effects. They have more side effects than most other medications. The other thing, some of the medications you use for CRPS were originally introduced for other things. They could be blood pressure medications. They could be medications as antidepressants, seizure medications. Please try them. Make a note of what they do for you. If you stop a medication, see why, so that it doesn't have to be repeated again. Sometimes the doctor says, yes, you had an issue with this medication or the other, but I want to try it or a different medications in the family. Try it. I think you're going to find that with medications, your life will be better most of the time. Most CRPS patients need something. Pain can cause sleep issues. Make sure this is addressed, not just with medications, but with other ways as well. CRPS medications have a higher side effect profile. They do. They can cause dry mouth, sedation, loopiness, sluggishness, sleepiness, anxiety, you name it. Some of them, they can cause the opposite effect of what the medication usually does for you. Don't worry, use it, and I think it's good for you to be able to do the right thing. Try the medications of different kinds. Don't be surprised when you go to the pharmacy. I have a lot of patients that the pharmacist calls me and says, are you sure you wanted to prescribe this? Because the pharmacists are vigilant. They want to make sure the patient is taking the right medications, and they might question you because in general the medication that you're prescribing may not be famous for as a pain medication. The doctor will talk to the pharmacist, or you can educate the pharmacist. Pharmacists there are to help you use them. Don't worry about taking even a lot of medications if you have to. Definitely try medications. Definitely try several types. Don't be shy in using them. They're good for you in general, and they can do a lot of good down the road. You just have to find the right medication, that's all. In certain situations, opioid medications can be helpful. I do not want to emphasize that opioid medications have risks, but at the same time they can be used, they should be used in certain situations, and you should work with your doctors to see if they are the right thing for you. A lot of times, especially when there is actually no help anymore, there is nothing you can do, nothing else you could do, you have no choice, and therefore you have to do what you have to do with not opioid medications or whatever else you need. So don't feel bad about using them, but don't overdo it. Work with your doctor. Wrapping up a little bit, there is a lot waiting for you. Get involved. Get involved in your treatment. The more you're involved, the more you benefit from the treatment. people like you succeed in their lives. Yes, there is a lot of suffering. Yes, there is a lot of hurdles you have to go through, but it's worth it. You are a conqueror. You are not a casualty. You can have a good life. Active exercises, by active I mean things that you have to do yourself. Moving the arm, doing stretches, a little walking, a little weight bearing, a little desensitization. They are excellent for reduction of the pain. They also help you with your autonomy in life. One of the major problems CRPS patients have, I'm sure you know, is that they can't do a lot of normal things. But you know what? Activity, exercise, and good planning will make it much easier. Some parting shots. You are a CRPS hero. You conquer difficulties and you manage life every day. Keep moving, keep having exercises, keep getting out of bed, keep enjoying things that you usually like. Please, please learn relaxation techniques with a psychologist, with a book, with YouTube. I don't care. Better with a psychologist. Yoga may be good in certain cases. Hypnotherapy can be very good. Learn a way to relax yourself, to get out of the mess and grind of daily pain. Get help from friends and family. Get support groups. They match each other. Friends and family are your loved ones. They don't experience your pain, so it's a little difficult for them to give you everything. A support group does give you a lot. Get professionals who are experts in the field. Try new things, try new approaches, try new procedures, and best of all, communicate with what's going on with your doctors, with your family, and I promise you things will get much better in life. Thank you, and I'm honored to be working with you.